am joined with Dr. Kimberly Ford and Dr. Carlton Scroggins, and we have a great show planned for you today. I always say that I'm here to entertain, educate, and engage you, and that's exactly what we're going to do today. So my first guest that we're going to talk to is Dr. Ford. How are you, Dr. Ford?
I'm doing great. Thank you for having me.
I am so glad that you're here. So a couple of things about Dr. Ford. She graduated from Michigan University. That is the third highest ranked school for dentistry. She went to school there and came to Maryland, and she's been here for 22 years. And she is my personal dentist. So I'm totally excited to have her here. Let's give her a round of applause.
Thank you.
All right. So tell us, what made you actually want to get into dentistry?
Well, originally I was interested in going to medical school until I met a classmate of mine who was going to dental school, and I thought, it's kind of strange. She wants to work in people's mouths all day, but she was very enthusiastic about it, and it got me interested. So I took a job in a dental office, and I loved how hands-on it was. Versus medicine, where you don't necessarily get to see results right away. With dentistry, it's very hands-on, and I loved that it was, to me, a perfect blend of science and artistry, because you really need to be a decent artist to make people's teeth look as good as they feel. So for me, I like the hands-on work. I like being able to create smiles for people to improve their lives and make them feel more confident about themselves.
Absolutely, and you say that because your smile is the first thing you see, and then so people definitely, that's one of the first things they look at. It kind of brightens your face, or it does the opposite. So, like, how long have you actually been practicing as a dentist since school?
22 years.
22 years, wow. And in 22 years, I'm pretty sure you've seen a lot, right?
I've seen just about everything, yes. Yeah.
Okay, so as a dentist, just basic education for everybody. How often should someone see their dentist?
So for somebody who has a healthy mouth, it's recommended that you come in twice a year for cleanings and exams. If people have ongoing conditions, if they have periodontal disease or gum disease, then sometimes we'll have them come 3 or 4 times a year for their cleaning so that we can stay on top of it, make sure that the disease isn't progressing.
Okay. And so when you're coming to have your regular visits, do you have to have x-rays every time, or you just have the x-rays as needed?
It should be as needed. Standard is about once a year. Again, that's for somebody whose mouth is relatively healthy. We do need to take x-rays because that allows us to see in between the teeth. We can't see in between the teeth with the naked eye, so that allows us to detect cavities that could be forming before we could see them clinically. So generally once a year. If somebody is extremely healthy and has never had a cavity in their life, we could go up to 2 years, but that's on a case-by-case basis.
Okay, so definitely, refer to your dentist to see how often you'll need to actually come. What can people do at home to help their teeth remain healthy and stay in the best, state that it could be?
Well, the most important thing, and nobody wants to hear this, is floss.
I know.
Nobody likes to do
floss.
it. And the thing is, with any habit, the more you do it, the better you get at it, the more comfortable you are, and it just becomes a part of your routine, and you don't mind it anymore. Brushing is great, and you should brush twice a day. It only takes plaque 14 hours to form. Plaque is the white fuzzy stuff that starts to grow on your teeth when you haven't brushed in a while. And plaque is made up of bacteria. It's the bacteria that causes gum disease, causes cavities, causes bad breath, etc. So since it only takes 14 hours to come back, we recommend brushing at least twice a day to keep on top of that. And flossing once a day would be wonderful, especially before bed. You don't want to go to bed with food and plaque between your teeth and have it sit there all night and cause disease.
So you suggest brush how many times a day?
Brushing twice a day.
Twice a day.
And if you can floss once a day, that would be wonderful. Yeah.
Okay, so are there certain foods that are because some foods can stain your teeth and different things like this. So is there certain foods or anything, that someone could drink that would really be bad for keeping your teeth healthy?
Well, stain is not necessarily unhealthy, but it doesn't look as nice. But yeah, the drinks you should really avoid are sodas in particular, even diet soda, sugary drinks, sports drinks, etc., and anything acidic. So anything that's carbonated, anything that has bubbles in it, the carbonation is carbonic acid. So that acid breaks down the tooth structure and causes cavities. So even if it's diet soda, people say, oh, when they drink Diet Coke, there's no sugar in it.
Right.
And that's true, but there's a lot of acid in it. And it's the acids that break down enamel.
That's interesting because you never think about things being so acidy because we have fruits that are just naturally acidy, right?
They are.
And so you just, now that you're saying that, again, I'm being educated about this, you think about just everything you do. So, I mean, I know some people that brush after every meal. Is that like over the top or is that?
It depends on the person. For people who are cavity prone or disease prone, that's a great idea. For most people, it might be overkill, but if it makes them feel more confident, their breath feels fresher, etc., that's fine. It's hard to overdo it unless you are using too stiff of a brush. You can wear the enamel off your teeth if you're brushing too much.
And that was my next question. There's always been a lot of back and forth of what kind of toothbrush is the best and what helps get the most, your teeth the cleanest. So what kind of toothbrush do you think is the best that somebody could use?
My personal favorite is the Braun Oral-B that has the small round head that spins in a circle. So hand brushes are fine if you are spending the time to do a thorough job. It should always be a soft bristled brush though, never medium or hard bristles. The medium and hard bristles are too aggressive and they can actually cause gum recession and enamel wear. So any soft bristled toothbrush. The electric brush I like because it spins, it takes so many more strokes than you ever would by hand. People are just not patient in general with it. So it's just going to do a more thorough job than you would by hand. Plus it has a timer, so it makes sure that you're spending the full 2 minutes and not cheating and just kind of zipping through it and be done.
And so when you talk about, because like you said, there's so many different brushes that people can use, and I'm kind of old school. I have just upgraded last year with getting a motorized toothbrush, right? But when you think about how should you brush your teeth, because typically people think you're supposed to go this way, but from you I learned you're supposed to go in the circles. But why? Why is it smarter to go in the circles opposed to just the regular?
Okay, so that's a great question. So the teeth are rounded, they're curved, they're not flat, right? So that's one thing I like about the Oral-B is it has the round brush head that sort of cups the tooth at the gum line. But even if you're using a handheld brush that is more flat, you want to angle the bristles towards the gum line, so up towards the top or down towards the bottom, and do a circular motion so the bristles can work their way under that gum line. If you're just going back and forth, the brush is going to sort of bounce around more and you're going to miss those in between places.
Wow. And then, when you think about just the cleanliness of your mouth, the tongue, I mean, you always talk about just everything when we're going through my exams, but just explain to our viewers and all our listeners, what is the importance of brushing the tongue and getting that part of the mouth as well?
So the tongue can harbor a lot of bacteria. Everybody's mouth has bacteria in it, and that's normal. You should have bacteria, but it's a matter of keeping things in balance. So a lot of times when people come in complaining that they have bad breath, they say, I brush, I floss, I use mouth rinse, but I still have bad breath. And it's because the bacteria is sitting on top of the tongue. So if you brush your tongue off, it's going to just help remove the bacteria. It's going to help improve the breath. Plus, if that bacteria is on the tongue, it's going to grow and spread and get on the other structures in your mouth.
Wow. And then so when you think about mouthwash, I mean, there's so many ones. I think about Listerine. People just always kind of go to that. I mean, it's like really, really strong. But what mouthwash do you think are better for teeth?
So I like the newer ones they've come out with that do not have alcohol in them. A lot of, like you said, the Listerine that's very strong, it tastes so strong because it has alcohol. Alcohol can be very drying, and drying your mouth actually makes you more susceptible to cavities and gum disease. So for people who have issues with that to begin with, we don't want to add that alcohol and add that extra drying ingredient to it. So Crest Pro Health and Listerine also makes an alcohol-free version now. I think it's either called 1 or 0, but I would stick with the alcohol-free. And it's a great adjunct to brushing and flossing. It's an extra, but a lot of people tend to use it as a cure-all. They say, well, I don't have to brush because I'm using the mouthwash.
Right.
And the Listerine was actually censored a few years ago for
Really?
false advertising because their ad said, kills 99% of the bacteria.
It says it on the label.
It does. Well, now if you look closely, it says in very tiny print, it kills 99% of the bacteria that it comes in contact with. And the reason they had to add that is plaque is a biofilm. So plaque is thousands of layers of bacteria on your teeth. The Listerine only comes into contact with the top layer, so it kills the surface layer, but it doesn't kill everything down to the surface of the tooth. So that's why you still have to brush and floss it off. Plaque is sticky. You cannot rinse it away.
Wow.
So that's, it's kind of like everybody wants the magic weight loss pill.
Absolutely. We want the quick.
Right?
We're in the world where we want the quick
You
fix.
want immediate satisfaction.
Yeah, we want
yes.
immediate satisfaction. We want to do it like right now, and we want it now. And so what you're telling us, basically, there is no now. There is we have to actually do the work.
Right. There's no substitute for flossing. I don't care what the Sonicare ads or the Listerine ads say. There's nothing that replaces flossing.
Wow. Wow. That's a lot. I mean, that's definitely a lot. And I know just even with my own teeth, and just trying to keep up with everything and making sure that you try to have that healthiest mouth. I mean, because like you said, your smile is the first thing people see, and they'll judge you on that. As it relates to, because we're talking about the healthiness of the mouth, when someone comes to you and in your first orientation with a person and you're getting to meet them and you're talking about the healthiness of the mouth, what are important things that someone should talk about with their dentist? Like, if I'm meeting you for the first time, what are good things for them to ask their dentist about the health of the mouth?
Sure. So when we have a new patient come in, we do a very thorough exam. We get images of all of the teeth. We measure the gum and bone levels. So we take measurements to see where the gum and bone levels are. That's really the only accurate way to assess whether somebody has bone loss or has ongoing periodontal disease.
Right.
So if you've had it done before, you remember they call out a lot of numbers, 2, 3, 4.
Yes.
And that's really the only accurate way to do it, and it's considered the standard of care. And I'm always surprised when I have patients who come in who say, I've been going to this dentist for 30 years, they retired, and they've never had this done before. Because it's actually...
that is so true. Because before you, I felt like, I was being upgraded because you were really thorough with everything, and I'm just like, oh my goodness, I've been going to the dentist all my life, and I've never had this level of experience and this level of detail. So yeah, I mean, when you think about the things you should ask a dentist and what should be important, because it's kind of marrying a relationship, because I'm going to see you a couple times a year as long as I do what I'm supposed to do. But the other side to it is, to your point, there are so many people that get slighted on the type of care they should be receiving. So to someone, what would be, if you were looking for a dentist, if you were looking for a dentist, although you are a dentist, what things would you actually look for in that dentist?
Right. Well, that's a great question, because unfortunately, in any field, you have people who do better work and people who don't do as good of work.
Right.
And unfortunately, as a consumer, you don't really have a great way to assess that. You basically know if you like us, if you like our personality, or if we hurt you.
Right.
and that's
true.
pretty much all you have to go on. So I usually recommend ask your friends and family, ask your coworkers, where do they go, are they happy, and look at reviews. I'm a big fan whenever I'm searching for a new provider. I do a thorough search online and look at reviews from multiple sources. Keeping in mind that a lot of people who tend to leave reviews, people are much more willing to leave negative reviews than positive.
Okay.
So
that's true.
You have to sort through and really look and see, are they getting the same type of review multiple times? Then that gives a little more credibility to it.
Right.
Is it one person who is spouting off, but you could be a person who's difficult to please? You have to take that into consideration. But definitely views and ask friends and family.
And then the other side to it is, certain sites like Yelp and just other sites, you can't get those reviews pulled off, right? So you have to look at multiple sites, because some sites people can pay to get bad reviews pulled off.
Yes.
So, just as a consumer myself, to your point, friends and family, but I also look at different sites for reviews, because I do know that there are certain sites that anybody can pay a certain amount of money and actually have them pulled off. And if they were legitimate situations, you definitely want to just do your research. So we're going to take a 4-minute break, and then we'll come back with the really good stuff. I know everybody wants to know about the cosmetic side of dentistry, and we're going to get into that. So we'll take a 4-minute break, and we'll be back. You doing okay over there? Sorry, I stumbled in it.
No, it's fine.
Cold and I'm like,
Beautiful life. What a beautiful life. Beautiful life. Listen, I woke up this morning, y'all, quietly. I thought about how good this life is back in the day. It wasn't always like this. I think about the things we done been through. I think about the place that I come from. It wasn't always easy, so every day I'm thanking God for the beautiful people everywhere I go. I just need to see your smiling faces at my show. And when you're feeling real love from the family, every day is a gift, y'all, that's all I need.
What a beautiful life.
All that I've got, all that I need. I've got you, baby, you got me. What more could I ask for? Beautiful life. Beautiful life. A beautiful life. A beautiful life. A beautiful life. Beautiful life. Beautiful life.
back. If you missed the first half, you're here with Let's Talk with your girl, Lady Boss Number One. And I'm here with Dr. Kimberly Ford and Dr. Carlton Scroggins. And if you missed the first half, we were talking about your teeth and how to keep those things healthy and what you should do and what you should not do with it. Now we're getting ready to get into the fun stuff, the cosmetic part of dentistry. And like I said, Dr. Ford definitely is dear to my heart because she took care of my teeth, as beautiful as they are. So we're going to get into the good stuff. So Dr. Ford, what is the most common procedure far as cosmetic work that you get?
Well, we have a lot of people come in who would like to whiten their teeth. That's a pretty popular one, and it's pretty easy and straightforward to do. We have a lot of people who are doing Invisalign. So it's a way to straighten your teeth without the metal brackets and wires. And I'd say the majority of my cases for that are adults, which is interesting. It's a lot of people who either couldn't afford braces when they were kids.
That was me.
Yep. Yeah, parents couldn't afford it at the time, and now now they want to do it for themselves. Or they had braces as a kid and didn't wear the retainers, and the teeth relapsed, and so now they're going through it again as adults. And implants are very big right now as well. So for people who have lost a tooth, the best way to replace it is with an implant.
Okay, so tell us the difference for those who don't know. What's the difference between an implant and like a veneer?
So veneers and crowns are coverings that go over the teeth, and they can be done for different reasons. Veneers are typically cosmetic. So if somebody has teeth that are discolored or misshapen and they want to improve the appearance of them, a veneer is like a ceramic or porcelain facing that is bonded over the front surface of the tooth to correct the color, shape, size, etc. of the tooth. So they're generally cosmetic. A crown is similar, but a crown covers the entire tooth, front and back. So they can be used for cosmetics, or they can be used to restore a tooth that's broken down, had a large filling, has a crack, has a large cavity, something like that.
Okay, and then the bonding, when they talk about bonding teeth, what is that?
So bonding is the filling material. So it's a composite resin, which is a tooth-colored filling material. So it's the same material we would use to fill a cavity. But if somebody has some discolorations or something they're not happy with about the appearance, we can use bonding, and it comes in multiple different shades or colors to make the tooth look better. The biggest difference, though, between bonding and something out of ceramic, like a veneer or a crown, is bonding is less expensive, it's faster and easier to do up front. So it can be done in one sitting in the office, and it's much less expensive. Now the flip side to that is bonding will pick up stain over time, it wears and chips more easily. The ceramic, either crown or veneer, is more expensive and is a little more involved as far as how long it takes to do start to finish. It's multiple appointments. However, they last much longer and they don't stain.
Okay, yeah, that's a lot of information, and I'm pretty sure a lot of people didn't know that. So when you're thinking about getting those type of things done to your teeth, what are the deciding factors that you would recommend to someone?
So one of the biggest ones is the bite. So we have to take that into consideration. People who have a very deep bite or grind their teeth a lot, veneers probably aren't going to be a great option for them because they're fairly thin and they can fracture off pretty easily. So we definitely look at the patient's bite. We look at the shape and size of their face, how much gum line shows when they smile. Some people, when they smile, you barely see their teeth. Other people, you see all their teeth and some of their gums. So we need to take all of that into consideration to see what's going to fit their profile best.
Wow, and so I'm pretty sure you do have patients that come in and they're dead set on, oh, I want the veneers, and they're not open to doing anything different, or, even if they have the big gums, is there any way to, I guess, shave that gum down? Is there any way to do that?
There definitely is. For that type of work, I would have them see a periodontist. That's a dentist that specializes in gum and bone work.
Okay.
They can have what are called gingivectomies, which is reshaping of the gum tissue. So if their gum line is uneven and they want to do all of their front teeth, then sometimes we'll have them get the gingivectomies or the gum reshaping done first so that their gum line is even, and that way the teeth will all be the same size.
Oh, wow, so there is a way, even if you do have that. So listen to that, folks. You don't have to be stuck with the smile you're born with. We can definitely get it altered and actually have exactly the smile that you want. So what are the benefits of someone actually getting the veneers or getting some of the other things you've highlighted? What are the benefits of that?
Well, of course, it's going to make somebody look better, which is going to make them feel better about themselves and give them more self-confidence. But also, especially with things like Invisalign, a lot of people think that straightening their teeth is just for cosmetics, when really it goes a long way towards helping you keep your teeth healthy. So if your teeth are crowded and overlapped, it creates more spaces that plaque and food collect, and it makes that person be more susceptible to cavities and gum disease. When the teeth are straighter, they're much more easy to clean. You can floss more easily, you can brush more easily, and it's going to help maintain the health of the gums and bone better. It also helps prevent them from wearing. So if your teeth are misaligned, going back to the bite issue, the teeth are misaligned, they're rubbing together in ways that they shouldn't be, you wear enamel off the teeth. So if we bring the teeth into the proper alignment, it's going to help preserve enamel over time.
And so, with keeping all that in mind with the teeth, are there any patients that you absolutely recommend that this, like, okay, yes, you do need this versus, well, because I know when you and I first met, the first thing you wanted to talk about was the health of my teeth. And you talked about how healthy they were, but I was really adamant. And you definitely gave me the pros and cons to what the difference would be and all of that. So is that generally how you consultate, your patients, to just kind of give them everything that's needed for that?
Yeah, so I like to explain all the options, give all of the pros and cons, and then really ultimately it's up to the patient to decide what they want to do. Everybody should be in charge of their own health and an advocate for their own health. So you should ask as many questions as you need to ask until you feel comfortable making a decision. And I can tell you, say pros and cons, I can even tell you what I would recommend or what I would do if it were me. But ultimately the patient has to do what they're comfortable with.
Yeah, and let me ask you this. So when doing any of this, I know there's so many innovative ways now. Would you be able to tell somebody exactly how their smile would look at if they got these things done, like how it will look before we actually did it?
Yes, actually there are several ways to do that. So again, with the Invisalign, there is a simulation program that we use. We have a digital scanner where we scan all the teeth in, and it makes a 3D model of your teeth on the screen right in front of us. And then we run it through a simulation program, and it will show you a before and after. This is how you look now. This is how you would be expected to look once we're finished with the treatment. And then for other procedures like crowns and veneers, if the patient really can't visualize it, we can take impressions of the teeth as they are, send it to the lab, and the dental lab will do what's called a wax up, where they will take the model of the patient's teeth and create the new teeth out of wax, out of white wax, and then we can show the patient the model and say this is what they would look like with crowns or veneers.
Definitely, and that's always like a big thing, because like you said, most often you can't envision how it's gonna actually look. But then once you do see it, for me, it was a win-win. Once I saw how beautiful they looked, I was like, wow, this is how my teeth are gonna look. So I was immediately bought in for it, because in my mind I knew that's what I wanted. But then when I saw that example of how it looked, it was like, it's a no-brainer. How long does procedures like that take? So if we're talking about the veneers versus the Invisaligns versus the crowns or anything like that you've explained, break down what is the time frame for those.
Well, Invisalign is going to vary depending on the case. Some people have minor crowding. It could be as little as 6 months. I've had cases go several years. The average is about a year to a year and a half. With crowns and veneers, it's usually 2 appointments. The first appointment, the patient comes in, we prepare the teeth for the crowns and veneers, we take the digital scans, and then we place temporaries. The lab takes the digital scans and makes the final product, the crowns or the veneers, out of ceramic from that. The patient comes back 2 weeks later, we remove the temporaries and cement the permanent product. So that's usually 2 visits. The first visit, depending on how many we're doing at a time, anywhere from a single tooth to multiple teeth can be anywhere from 1 to 3 hours. And then the second visit is usually less than an hour to put them in.
Have you ever had anybody that had them all done, like everything, top and bottom?
Yes, well, you, for one.
I know. Yes.
But yes.
Is that common, though?
It's common. It's fairly common. So, the full mouth reconstructions may take longer. So
Yeah.
if it's multiple teeth like that, a lot of patients just can't tolerate sitting in the chair for that long. So we'll break it up into sections and do different sections of the mouth at a time. And we also do sedation. So I've had a couple of patients who want the work done, but they're fearful. They're very anxious. So we've had cases where the patient comes in the morning, we put them into a twilight type of sedation. So they're not unconscious, it's not a general anesthesia, but they're just sort of off in their own little world. And we work on them for 4 or 5 hours, and they wake up at the end of the day and go home, and they're done. So
Yeah, because I know for me, initially when we started talking, I wanted to get the tops done. So we did the tops. And then once I saw the tops and I looked at the bottoms, I'm like, well, wait a minute. That doesn't look too good. And I'm like, now with the bottoms done. You said, I told you would want the bottoms done. But again, me thinking I'm smarter than the doctor, I was like, nah, I just want the tops done because, again, I had the really big overbite. So that's what I saw. But it was so funny because after the fact, I saw that the bottom teeth were crooked too. I was like, well, wait a minute. She was right. She's a doctor. She knew exactly what she was talking about. So, yeah, I mean, do you have patients that like me that start off one way and then say, well, you know what, you're right?
Absolutely, absolutely. And, for multiple reasons. One, is fear or anxiety. I think a lot of people, it's just the fear of the unknown. They expect it to be more traumatic than it is,
Yeah.
so they're hesitant to do it. And once they do one, they're like, that was really nothing. That was really pretty easy.
Right.
So then they say, hey, this isn't so bad. Let's do the rest.
And that's exactly what it was for me too. I was like, yeah, I mean, I loved it. It brightened my smile, and I was like, it's a no-brainer to do the rest. Are there any risks when you're having these type of procedures?
Well, sure. The treatment planning or case planning is always very important. You want the dentist to look at your case, your whole mouth in its entirety thoroughly ahead of time to make sure, again, is the bite going to accommodate the ceramic? Is the patient's mouth healthy to begin with? Obviously, we don't want to start a major reconstruction case if somebody has gum disease or, a lot of cavities. So we want to get them to a healthy state before we start.
So with that being said, somebody that's thinking about having this done, the first thing would be to see exactly how healthy your mouth is, because if in your mind you're going to have this done in 3 months, but you have health issues in your mouth, that 3 months could turn into a year depending on the state of your teeth.
Exactly.
So that's true. That's truly important because we want what we want, but from a professional perspective, sometimes you can't get what you want right then and there. So just knowing and understanding that it could be a process.
Exactly.
And if it is, that's okay, because that's what you need to do to actually get the best result.
Right. You need to go about it the right way. You have to have a solid foundation to build on. If your gums and bone are not healthy, we can do beautiful cosmetic work, but it's not going to last if it's not built on a good, healthy foundation.
So that was my next question. So, sometimes as people get older, the teeth fall out and different things like that. When you're having the veneers and some of that cosmetic, is that forever? Do they forever stay in, or?
Well, the biggest reason that crowns or veneers fail is if people get decay around or under them. So a lot of people are under the misconception that when you put a crown on the tooth, because all of the part of the tooth that they can see is covered, they think that it's basically decay proof.
Right.
But it isn't.
We do.
Right.
We think that.
So, bacteria are small and they're sneaky and they can get into just about anywhere. So, the crowns or veneers come to the gum line and maybe just under the gum line, but the bacteria can get further. So if you're not brushing and flossing, you can get cavities under crowns and veneers. So again, it comes back to keeping everything healthy. The other thing that can happen is they can fracture. So just like a natural tooth can fracture, you shouldn't do anything with a crown or veneer that you wouldn't do with your natural teeth. So you shouldn't chew ice, you shouldn't chew hard candy, you shouldn't tear plastic bags open with them.
All of this stuff. You guys are chew ice. I mean, I'm not ice sure, but hard candy. I'm like,
yes, you should not.
See,
You should not.
I knew. Oh, see.
I used to be an ice chewer. I loved chewing ice, but I saw so many patients coming in with fractured teeth that I made myself stop. Not only is it very hard, but the temperature extreme between the heat in your mouth and the coldness of the ice makes the enamel expand and contract and makes it more susceptible to fracturing.
Wow.
So,
who would have ever known, This is exactly why you're here. So are any of these procedures covered under insurance? Because I know that's what people are thinking. Like, does my insurance cover it? Is this all out of pocket? Talk to us about that.
Well, that completely depends on the insurance plan. And people will ask me all the time, they'll say, well, I have Delta, or I have Blue Cross, is this covered? But the thing about that is Delta, Blue Cross, Aetna, they have thousands of different plans. And most of the plans, if it's through an employer, the benefits for that plan are picked by the HR department. So they'll say, well, does my plan cover braces? Well, Delta has some plans that cover them and some that don't. So it depends on what benefits were included in your plan. So it's not a straightforward answer. Usually we would have to actually know your specific plan and group number for us to look that up and see whether or not it's a covered benefit for you.
And then I know for me, when I initially started coming to you, I was Blue Cross Blue Shield, and then it switched over to Aetna. And just one thing people can always do, call.
Yes.
Call the insurance company yourself before you even link up with the doctor and say, hey, I want some veneers. And they're very specific with telling you what's going to be covered and what's not going to be covered, and what deductibles you have to meet. So that kind of helped with our situation a lot, because I'd already did it. Once I told you what I wanted, I did some of the backlog work of, okay, this is what's going to be covered out of pocket, and this is what's not going to be covered out of, I'll have to actually take care of. So it worked for me because I knew ahead of time how to structure that. With the range of the procedures that we talked about, what is the least expensive all the way up to the most expensive that it could go?
Well, as far as cosmetic procedures, the least expensive is going to be the whitening and the bonding. A lot of offices charge a high fee for whitening, when it really it's a profit maker for the office. So ours is very inexpensive. We charge $199, and that's for custom whitening trays that are made to fit your teeth, plus multiple syringes of the gel that will give you enough to do an initial treatment plus several touch-ups. I know a lot of offices charge $400, $500, $600 for the same type of thing.
Yes.
The other thing with the whitening, don't fall for the zoom, the bright light that you put on.
Yep.
It does nothing.
That is so popular
It's
because
very
a lot
popular.
of the our TV folks definitely use that. When you look
Right.
at a lot of the celebrities, they always definitely plug in that, oh, the Zoom is
Right.
great in there. And so you think, oh, wow, if they're using this must
Right.
be great.
Remember, yes, they're being paid to promote it.
This is true.
Right?
So yeah,
Yeah,
this is so
research
true.
has actually shown that blue light does absolutely nothing to enhance the whitening.
Nothing at all.
But because nothing at all,
Imagine
and
that.
because your mouth is open so long, the teeth get very dehydrated, which actually causes a lot more sensitivity. So we had the Zoom at one point, and all these new studies came out, and we got rid of it. It's overpriced. It doesn't do anything more than the regular whitening gel does, and it causes more sensitivity. So
Wow.
stay away from that.
The white, see, we're really learning. See, right? We didn't know this was the thing. So let me ask you this. Just closing this out. Are there any candidates all the things we talked about that would not be good candidates for this? We talked about people that don't have healthy mouths, right? So naturally, they would definitely have to get work done to become a good candidate. But outside of that, as far as health issues and different things like that, are there any other people that this type of stuff wouldn't be good for?
In general, no. Most people we can work with. There are some things that can actually. So thinking in reverse, actually, your oral health plays a big part with your general health.
Okay.
So there have been multiple studies that have come out over the last 20 years or so showing that the bacteria in your mouth contribute to heart disease.
Really?
Yes, absolutely. Yeah.
You knew that one. Okay, all right,
Yeah.
all right.
So, for people who
Wow.
have heart disease, it's very important that they keep their mouth healthy. And doctors will actually refer patients to us who are getting ready to go for surgery. As part of their pre-op, they'll send the patients to the dentist to make sure that their mouth is clean and healthy, because they don't want that oral bacteria getting into the bloodstream and causing other health issues.
Who knew? Oh my goodness. Like I'm having all these aha moments. Oh my goodness. Wow, that's a lot.
Yes.
That is really a lot. So, Dr. Ford, yeah.
You get many requests for lightning gums?
No.
Gum lightning. Is that do people
No,
use
I
that?
have not had anybody
Lightning
request
gums.
that. People have different tone to their
Yeah,
gums, just like you
darker
have different
gums.
skin tones.
Yeah.
So we do see a variation. They can be anywhere from light pink to bright pink to even
Right.
dark brown.
Right.
Yeah. I saw that.
But I've never had anybody request to change the color of their gums. But that's interesting.
But could you change it though?
I don't think so. I think
Okay.
the only thing you could change is if the gums were red because they're unhealthy. Of course, getting them healthy would make the redness go away. But as
Right.
far as the natural pigmentation,
Okay.
not that I'm aware of.
Okay.
Have you had people ask you for
My
that?
daughter.
Oh,
So you said my wife might as well ask the dentist right now.
Yeah.
Wow. So based on what she's saying, you would have your daughter to go check her health of her mouth first
Right.
to make sure the mouth is healthy, and if the mouth isn't healthy, maybe that's why she's seeing the discoloration.
right. It could be, again, natural pigmentation. Everybody has different
Might not
skin
like
tone.
natural
It's the same with your gums.
Wow. Okay. So Dr. Ford, just for everybody, where can they find you? How can they get in contact with you? Do you have social media? Tell us all that good stuff.
Okay, sure. So I'm located in Ellicott City. Major cross streets are Route 29 and 40. The name of the practice is Ellicott Mills Dental because we're on Ellicott Mills Drive in Ellicott City, right outside of the old historic downtown, right up the hill from that. We're on Facebook. You can just look up Ellicott Mills Dental. Of course, Google us. Our phone number is 410-461-3311, and you can look at EllicottMillsDental.com as well.
Okay, well, it has definitely been a pleasure having you here. I definitely learned a lot. I mean, I always learn a lot anytime I'm in your presence, right?
Thank you.
And so even the doctor over here learned a lot too. He's sitting there taking it all in. And so is there anything else? I mean, you're such a great dentist. Is there anything else you want to do? Something in this field that you feel that you also want to do?
Yes, actually, I am leaving very early tomorrow morning to go to a week-long implant placement course. So I've been restoring implants for years. In other words, the surgeon places the implant and I put the crown on it. And I've taken classes before. So I just wanted to get a little further into it. So next week I will be out of town for an entire week, placing over 30 implants, so that when I get back to my practice, I'll be ready to hit the ground running with that.
Wow, I love a doctor that always continues to learn.
Yeah, always try to bring something new in, some major service that I can offer. Patients don't like being referred out. Whenever they come in, they're like, well, can you do this?
I'm like that too. If I come to you, I don't want to go to anybody else. I'm so spoiled. I'm like, no. I don't want to go to anybody else. No, you're right.
Right.
I totally
So
agree with that.
always bringing in new services. So, I did many years ago, did the Invisalign, the sedation dentistry, and now we're doing the implants.
Woohoo! All right then. So there you have it. Dr. Ford is definitely the doctor you want to see if you want to have a beautiful smile like mine. She's phenomenal. Definitely when you go see her, let her know that you saw her on this show, and she'll take great care of you. We're going to take a 4-minute break, and we're going to be back with Dr. Scroggins, the plastic surgeon.